Hello and welcome to Maryland University School of Integrative Health online course, Nutrition 833. This is Integrative and Functional Nutrition in Cardiometabolic Health. Hi, I'm Dr. Sylvia Regala, and I'm going to be with you for the next 15 weeks. Let me tell you a little bit about myself. I am an internist. I graduated from the State University of New York School at Buffalo, School of Medicine. And I have a degree in applied clinical nutrition, and I'm also board certified by the American Board of Integrative and Holistic Medicine. I practiced internal medicine for about 25 years, and then for the past decade or so, I've been practicing solely functional medicine and nutrition in Buffalo, New York. Well, we're going to be together for the next 15 weeks. And we're going to be examining cardiometabolic disease. And we're going to link cardiometabolic disease with applied clinical nutrition. So what really is cardiometabolic disease? Cardiometabolic disease are topics such as obesity, diabetes, metabolic syndrome, high cholesterol, high blood pressure, stroke, hypertension. So each week we're going to talk about a different topic of cardiometabolic health. We'll discuss the commonalities amongst all of these, and by the end of the 15 weeks you realize that the most common cause of these diseases are twofold. They're poor lifestyle changes and underlying inflammation. So each week of the different topics we'll be talking about, we'll review the biochemistry, the pathophysiology, and the function, and we'll put together a functional medicine and integrative approach to creating an individualized therapeutic treatment plan, which will include diet, exercise, supplements, as well as botanicals. And if perhaps there are any drug-nutrient interactions, we'll be talking about that. So each week we'll talk about a different topic of cardiometabolic health. The instructions for each week will be in your syllabus. The instructions are basically the same for each week. I will assign some videos for you to watch, and these videos are pretty much cutting edge. The videos are mostly by functional medicine practitioners. There are some videos by Jeff Bland, who is the father of functional medicine. We have many videos by Mark Hyman, Dr. Mark Hyman, who is a functional medicine family practitioner. And we also have some videos by Dr. David Perlmutter, who is a functional medicine neurologist. In addition to the assigned videos for each week, you'll have assigned readings. The two texts that we'll be using this semester are your functional medicine textbook, and in addition to that, we'll also be using Rakel's integrative medicine textbook. And the third thing that you'll have for every week is a PowerPoint presentation that I've prepared, kind of to summarize the high points of the topic that we will discuss for that week. Then every week you'll have a case study for our discussion board. So say if we're going to be talking about hypertension, the case study will reflect hypertension. You can also use, if you choose, your own case study of a patient or a client that you have or a relative, as long as it reflects the topic of that topic for that week. For week 14, I would like you to submit your own original comprehensive case study of metabolic syndrome. So that could be a relative, it could be a patient, it could even be yourself if you wish. And I'd like you to prepare a comprehensive cardiometabolic treatment plan for week 14, as with most of these case studies. So that would include a cardiometabolic food plan, an exercise program, perhaps supplements, botanicals, and drug-nutrient interactions if there are any. So you're going to have more tools in your toolbox by the time you finish this 15-week program. You'll have gone through 15 different case studies, true life case studies. So when a patient comes into your office, your clinic, you'll be familiar with their problems. Since you'll have more tools in your toolbox, you'll be able to create a very comprehensive, individualized clinical nutrition therapeutic treatment plan for each and every one of your patients. Most of the diseases we're going to be talking about are chronic diseases, and these chronic diseases are usually caused by poor lifestyle changes and inflammation. So you'll be able to direct your patients or your clients into eating healthfully. In the 5th century BC, Hippocrates said, "Let food be thy medicine, and medicine be thy food." Hippocrates is the father of Western medicine, and he recognized the value of eating as well as potential of certain foods for healing. So you are all nutritional pioneers. So let's take this journey together down cardiometabolic health. And I'm looking forward to getting to know all of you on our discussion board. I wish you all well, and we'll enjoy this journey together.